Well, hello there. Hello there. I am Dr. Wynn, OBGYN. I'm a board certified OBGYN. That's also a speaker, also a women's health and wellness expert, as well as someone who's here to help you change your day. I am here hoping that you guys will join in. We're going to talk about contraception and you. Hopefully, we'll have some questions. And I just want to make sure that you guys are involved and we can talk a little bit back and forth. And let's see if we can go ahead and get these comments. Hi, Sora Keisha. Thank you for joining me. Like and share this post. I would like to reach out to as many people as possible. We're going to talk today. I don't want it to always be just teaching. I want it to be a little bit of interaction. Hopefully, you guys will be able to. Hi, Jasmine. Thank you for joining. Go ahead and like and share this post. Hopefully, we will get some good information out to you guys. Excuse the reflection. I'm trying to work out this lighting situation here. If you guys have any suggestions, I'd greatly appreciate it. And so let's wait for a little bit and hopefully we'll get some additional people to join us. Like I said, we're going to be talking about contraception and contraception being birth control, ways that you can approach birth control, options for birth control, and maybe some examples. I have some photos available for you, and I'm hoping that this technology works out so that we can talk and you guys can learn. So when we talk about birth control, there are many different options, benefits for some of those options, risks to those options, and why some may choose one over the other. Most importantly, most people use contraception to prevent pregnancy. There are other ways that we can use birth control. And for some people that have period problems, we will use hormonal contraception for that as well. So when we talk about birth control, one of the most commonly known is the birth control pill. It's been around for decades. It's been something that our moms use, something that we have used, a lot of our friends have used. Is it the most effective? Is it one that women can mess up on the most? Yes. Why is that? Because you take it every day. The reason you have to take it every day because it wears off quickly. So one of the things that we like to do is talk about what those benefits are and potentially what those risks are. There are many different forms of contraception, many different forms of hormonal contraception that comes in a birth control form. So there's some that have two different types of hormone, estrogen and progesterone, as well as one that is progesterone only. And you may use those for different reasons. There are different types of progesterone in those. All of them have the same type of estrogen, but different types of progesterone, and they can be used for different reasons. So there are some that may help you maybe not spot as much as far as the level of hormone that's contained in it. But one of the biggest drawbacks to using the oral contraception, hi, Sans Tori, of the oral contraception is, what do you think that is? Not taking it at the appropriate time every day. So when you talk about estrogen and progesterone containing contraception, hormonal birth control pills, you don't have the same restraint, I guess is the best way to talk about that. You don't have the same restrictions, not restraint, the same restrictions. So you're taking it every day. That's great as long as it's estrogen and progesterone. But if you're taking a progesterone only pill, then there comes the problem because it doesn't have the estrogen in it. If you're not taking it at the same time every day, you could have a faster drop off in your hormone and the potential risk for ovulation and hence pregnancy. So that's why you'll see most women on the estrogen and progesterone containing form of birth control. So that is one of the most common and one of the most frequently talked about. Again, when you're looking at the estrogen and the progesterone, the problem comes in when you're missing your pills. So some women may get up, they may do the same thing every single day, and they're able to remember them every day. But for people who have schedules that may fluctuate, then you'll run into, oh my gosh, I forgot to take my pill today, or did I take it today? So again, I'm giving you this information just as kind of a surface conversation, and hopefully you'll have questions that we can talk about. But when you talk about kind of what comes to your own health and your own needs, you should talk to your own OBGYN or a family health practitioner about what might be the best choice for you. Because again, with hormonal control or hormonal contraception, there is always a potential risk if you have certain health conditions. That may include if you're a smoker over the age of 35, if you have high blood pressure, if you are on other medications, if you have liver disease, blood clotting disorders. So there's many different reasons why you shouldn't take hormonal birth control, and we'll talk about some non-hormonal options later. But that again is one of the most common, and so that's why I like to review it with you. So some of the other forms of birth control that you may hear about that are pretty common are the depot injection. So that is something that can be used every 3 months. You typically have to go to the doctor to have that injection done. And it's progesterone only. And some women like it because they don't have to deal with taking a pill every day. So it takes out the human error factor. So as long as you go back to your doctor during the time that you're supposed to get your next injection, it will usually be pretty effective. And so a lot of young people like that because they don't run the risk of forgetting their pills every day. So when you talk about the Depo-Provera, that's that injection, why do people like it? Again, because they are not missing that pill every day. One of the things that people complain about with Depo-Provera is the potential risk of gaining weight. Well, why is that? The progesterone containing forms of contraception, especially Depo-Provera, can potentially put you at risk for having increased appetite or increased hunger. So there are some people that will gain a little bit of weight on Depo-Provera. There are some people that gain a lot of weight on it, but it's not always all related to the birth control injection Depo-Provera. One of the things that I always tell people when they talk about the weight gain, I talk to them about it, make sure you're watching what you're eating, continue your exercise. But I also say, if you're using it for birth control, pregnancy can make it gain a lot of weight too in 25 years of responsibility. So you want to make sure that you are using that Depo-Provera regularly. And ultimately, I say try it for 3 to 6 months. If you don't like it, come on back to the doctor and we can talk about what other solutions may be beneficial for you. So additionally, for the Depo-Provera, it is used in some women to help control heavy menstrual bleeding. That's one of the other main reasons that a lot of us will use that. So again, if you're having any of those issues, conditions, then we have you talk to your doctor about that. Some other options, and I really wish that I had some of my tools that I use in the office so you can kind of see what some of them look like. But I'm going to pull up a screen and share a screen with you so you can take a look at that, and we can kind of go through some of those as well. So let me go ahead, pull that over, share that screen with you, and hopefully you'll get to see that. Okay, so let's pull it up a little bit. There we are. You can see it a little bit better. So one of the first things I talked about was the Depo-Provera, and you can look at the birth control pills, and you see here, when we talk about the effectiveness of the birth control, you can see here, it's kind of okay. So you look, this is per 100 people. And so you can have about 9 failures per 100 people with perfect use. But when we talk about the more effective forms of contraception or birth control, you can look here. And it says, oh, they work really, really, really well. Well, why is that? Well, it's about 1 in 100 that might fail during the course of the year. The most effective form is this this rod here, called the Nexplanon. It's an implant. It goes in the arm and it stays there for 3 years. It's progesterone only and one of the most effective forms. And so we like to use that in women who don't want to conceive within the next 3 years, want something that's long term. They don't want to have to come to the doctor regularly. to get an injection. Again, it's progesterone only, and it's something that is very effective. People say, oh my gosh, it's going to hurt. It gets implanted just beneath the skin. And just as a lot of us have had our ears pierced, we go in, we get those ears pierced, here, click, oh, it's uncomfortable, but then we don't think about it too much anymore. Similarly, with the next one on, we actually do numb the area before it's inserted. We insert it, you hear a click, and most patients will say, oh, is it over already? It's like, yeah, it's over already. We put a little Band-Aid, wrap your arm up, and you're on your way. And usually, like I said, with most forms of birth control, I recommend that you try it out for 3 to 6 months. There's always, again, risk and benefit to these contraceptive options with the progesterone. It's typically used in women, again, who for some reason or another cannot use estrogen. So that's one of those forms. So if you look over these next few here, they are also very effective as well. So we have the Skyla IUD, we've got the Mirena, there's another one called the Liletta, and then there is this one that's called the Paragard. The Skyla, the Mirena, and the Liletta all have hormone in it, which they are used from anywhere from 3 to 6 years, and we use them for different reasons for different women. The Skyla is typically used in younger women who've not had babies, who are not looking at having any children within the next 3 years, or have not had any children at all. This is good. This Mirena is good for women who are also having bleeding issues. And depending on what those bleeding issues are, the Mirena is a 5-year solution, which may help reduce the amount of menstrual blood loss that you have. So a lot of women really like that one because it can help reduce the amount of bleeding that they're having. So you say, okay, the benefits versus the risks. Again, we've talked about it's not estrogen containing. It's something that you can keep for 5 years. Essentially, some of the risks that are associated with it is the discomfort at time of insertion, the fact that you have to have it placed in the office. There are some physicians that will want you to have it placed when you're on your menstrual cycle, in hopes that it may help be an easier placement, as well as we know you're not pregnant during that time frame as well, if you're on your menstrual cycle with a negative pregnancy test. So as far as the copper IUD, which is this one here, that's the 10-year IUD. It has no hormone in it. And a lot of women love that if they do not want hormones in their birth control option, as well as if they desire to not have any children, for 10 years or more, because they'll have them placed back to back. So with that being the case, because it has no hormone in it, it does not help improve your menstrual bleeding. For some women, it actually may increase their cramping and bleeding, but typically that will decrease over time. And so another option that's not often talked about is a vasectomy in men. So that's where the vas deferens, or the tube that transport the sperm out, will be clipped. And so that helps to prevent pregnancy as long as the man goes back and has that evaluated to make sure there are no sperm left. For women, and that's typically for men, and it's an in-office procedure, give them a pack of peas and they go on their way. Very effective. A lot of men don't want to have it done, but it is something that can be very effective for them. As far as for women, having a tubal ligation done is something that can work very well for them. And it used to be done a number of ways, but now typically it's done either at time of C-section, or it can be done in the postpartum time period, or it can be done whenever you want after that. And typically a small incision is made within the belly button, and then maybe 1 or 2 more in the lower abdomen. And there are several different ways that we do it. But now, a lot of times what we're doing is we're removing the tube entirely in hopes to help prevent pregnancy, as well as decrease the risk of ectopic pregnancy, and potentially decreasing the risk of fallopian tube cancer and ovarian cancer. So that's one of the things that we're doing right now, actually removing the tube completely at time of sterilization. Okay. Other options include the patch, which I'm kind of hovering around right now, and the ring. Those are 2 options that include estrogen and progesterone. And other long-term, when I say long-term, not necessarily a month or 3, but something that you don't have to deal with every day. So the patch is something that you can use, and it's changed once a week. You put it on once a week for 3 weeks, and then you take it off for a week. And then there's the option for the ring, which is called a NuvaRing. It's something that goes in the vagina and it stays there for 21 days at a time. So you want to use that ring monthly. You put it in, leave it for 21 days, and you take it out and you throw it away. Why is that beneficial for some women? Because they don't feel it, it's not uncomfortable. They don't want to deal with taking a pill every day, but they're not interested in having anything in the uterus or having an injection. And it's reversible. Again, you remove it and you typically will resume your normal cycle the next month. So, any of those options are pretty good options as far as prevention of pregnancy when used properly. With the patch, this is something that goes on the skin. The hormone is absorbed through the skin and it will be effective for you. One of the things when it comes to the patch, though, is there is the potential that the more weight that you have on you, there's the potential effect on reducing the effectiveness of that patch. There are some people that also have trouble with the patch because of sensitivity on the skin because it is an adhesive. So that's something that potentially can be an issue for some people. Now, these ones at the bottom, the not so well, while they can work when used perfectly, you see how it has a higher number of people that will potentially become pregnant during that time frame. If I was someone that was trying to prevent pregnancy, that was not the first option that I would go with. We've got the withdrawal method. We call it pull and pray in my office. And a lot of people think that that's pretty effective. No, not unless you're also tracking your ovulation as well. And then you've got the diaphragm, which in my career of 15 years have probably fitted just a few people. There are not many people that desire the diaphragm anymore. And then the fertility awareness. So that's tracking your ovulation and condoms. Obviously, condoms we recommend for people who want to also prevent sexually transmitted infections because none of these birth control options do that. None of them prevent pregnancy, and none of them prevent transmission of HIV, STIs, or anything like that. Condoms can help reduce the transmission of some of those. So, are there any questions? What about the spermicide film and what is the effectiveness? Thank you, Alexa. Hi, I miss seeing your face every day. So the spermicide film, what is the effectiveness? So the effectiveness is probably going to be somewhere around here as the not so well. Spermicides can be effective for women, but one of the things that you have to consider is the irritation that may be associated with spermicide for some people. For some women, it may change the pH in the vagina, so they may have irritation. There's also, and I cannot remember the name of, there's something that when I'm watching Bravo, I'll see it promoted all the time. It's some new, does anybody know the name of it if you watch Bravo? Something that is being highly promoted right now. Essentially, it's a gel that goes in the vagina to help change the pH within the vagina and hopefully kill the sperm that enter the vagina before they make it to the cervix. The problem is, again, if it's changing the pH in the vagina, that potentially puts you at risk of vaginal infections such as yeast and BV. So spermicides, while they can work well in conjunction with something else, I don't typically recommend spermicide alone because it's not as effective as the other options above. Are there any other questions that you guys might have? One of the things that I did want to show you, I'm going to get this off the screen. We'll go back to here. Stop sharing the screen. It's not there. Oh, here it is. So let's go this way a little bit. There we go. So when we talk about the uterus, I was supposed to put this up when we were talking about the IUD. When we look at the uterus here, again, fallopian tubes and ovaries, people ask all the time, well, where is the IUD supposed to be? Some people think that it just sits in the vagina. That's where the NuvaRing would be. And this is actually showing you where the IUD is sitting. So the IUD, the IUD is actually within the cavity of the uterus or womb, as some people may call it. The IUD is inserted in the physician's office through the cervix, and then it will be deployed into the uterus and sits here in a T shape. And the strings will stay in the vagina. Typically, we tuck them behind the cervix so that your partner cannot feel it. We also will ask that you check your strings and make sure that they are there. And if at any point you can't feel your strings, we want you to come into the office so that we can check them and make sure that they are coming through the opening of the cervix and that that IUD is in the right location. Jasmine, you had a question. What do you recommend the most? Really, the recommendations are typically based off of what the patient desires. So, is the patient looking for something that is long term? Are they looking for something to also help control their menstrual cycle? So, it really truly depends on what the patient is interested in most. I have, and really depending on where I may be located at the time, there are some areas that are more interested in depot and others where there was a high population of people that were interested in having the next one on done. So, it truly depends on what you are interested in. Any other questions? Hopefully, as we kind of progress through the series of topics, you guys will be engaged and interactive because I want to make sure that you're gaining as much information as possible so that when you go to your um, physician's office, you are armed with information so you can have a conversation, an open conversation about what's going on. Well, thank you for joining us, Asia. Thank you very much. Please, again, guys, like and share so that we can get as much information and as possible. So, Asia, are there late side effects of birth control pills? So, I'm not sure what you mean by late side effects of birth control pills, but the potential for birth control pills for kind of helping control menstrual cycle and prevention of pregnancy are those things that we look at right now. What is helping right now? Potential side effects that I mentioned early is the potential risk for blood clots, blood pressure increases, stroke, things of that nature. But typically, those potential things happen less frequently than if you were pregnant. So while it can happen on birth control pills, the likelihood of it happening is actually less than if you were pregnant. Those potential things could happen during pregnancy as well. So other things, protection, as far as birth control pills, they can be protective as well, protective against ovarian cancer because you're not ovulating as frequently. So the potential to help reduce the trauma that happens to the ovary as we release an egg every month. So if you are preventing release of that egg every month, you're also reducing the trauma that can occur to the ovary. So how likely is your IUD to fall out? So, as long as your IUD is placed correctly, the likelihood of your IUD falling out is very limited if you have a normal uterine cavity. So, a normal structure, just as this one is here. See, there are no fibroids. Remember, we talked about fibroids last week. There's a normal structure. There is nothing that's blocking that IUD and it's in the appropriate location. So the likelihood of it coming out during sex, as another question was asked, the likelihood of that falling out is pretty limited. Now, if you have an abnormal cavity, if you have heavy menstrual bleeding, it was placed incorrectly, the uterus is too large for the IUD to be in the correct place, or if your strings are too long and your partner pulls on the strings or you pull on the strings, yes, it can potentially fall out. I do tell women when it is placed, make sure that you are not using tampons initially, making sure you're not having sex right away, just to make sure that the cervix closes back down and that those strings are able to be tucked and you're not actually yanking them out. Hi, BFF. Dr. Edwards Biddles here is on the line. Let's see, what does this question say? What about weight gain while on birth control? So, one of the things that we talked about earlier was the potential for weight gain to happen while you're on birth control. And so, when you are looking at progesterone only, yes, there is the potential for weight gain to occur. It can occur across the board, but typically very limited. When you look at the progesterone only, there are some forms that can make you hungrier. So, yes, you will gain some weight. And that is something that has to be managed. But I have people that are super skinny and on Depo, and it didn't make them gain any weight. So, while some people say, I gained 40 pounds on Depo, and I have some people gain none, the average might be 5 pounds year over year while you're using it. But if you're gaining 40 pounds from it, then there's something needs to be reassessed. One of the other things that we didn't talk about as it relates to the Depo-Provera, there are some conversations surrounding the potential for bone loss to occur when you're on Depo, because that Depo-Provera is blocking our normal natural estrogen. That's how it works, and that's how we prevent that ovulation from occurring. There is the potential for it to have effect on bone as well and potentially cause softening of the bone. But that's reversible. So it's not something that we typically say, oh, it's going to cause long-term harm. So let us not keep you on it for, many, many, many years. There are some people who will have that bone loss that we have to take off if they're on, have other diseases and, have that bone softening that becomes an issue. But we will investigate that and manage that per person. But most of the time, let me take this uterus off. Most of the time, that's not something that we're concerned about in young, healthy individuals. Let me take the uterus off there. Let's get back to the comments. Any other questions? We got good questions today. I love the interaction. Thank you guys so much. Thank you so much for joining. I want to make sure that if you have questions or concerns, that we can address them and you get those questions answered. Anybody else? Well, I want to say thank you so much for joining me today. I think that this was hopefully a good conversation, something that is beneficial for you. And if you want to keep going, if you have additional things you want to talk about, additional topics, I'm kind of just pulling them out the air from questions that people ask me all the time. But if it's something you specifically want to talk about, go ahead and send me a message. Comment on this video. Again, I'm always open to answering those questions. And I just want to say have a great day. Thank you for joining me. I appreciate you hanging in there with me. And again, join me next Wednesday at 7 p.m. If everything goes well and technology works well. We'll be back on at 7 p.m. next Wednesday. Again, I'm Dr. Wynn, OBGYN. I'm your board certified OBGYN. I am a national speaker. In addition to that, I'm a women's health expert. And I'm a mom and a woman who is here to help you with your mindfulness and your wellness. So if you're interested in joining me for a journey through your mindfulness, your wellness, I'm interested in making sure that you have your health and wellness in mind. Your wellness is absolutely one of the things that you need to make sure you are working on. Mental health wellness as well as your physical wellness. So if you want to join me on that journey, you can reach out to me at drwynnobgyn.com. That's drwynnobgyn.com. Or you can check me on all social medias at Dr. Wynn OBGYN. Now, the website will be forthcoming. So if you don't see that landing page yet, that's okay. Keep looking out for it. But reach me on the social media platforms. So thank you for joining me, and I will see you guys next week. Bye.